So I would say that the concept of using antibody-drug conjugates in the first-line setting isn't that new because we've been applying it to maybe some patients where we had to, but now it's an option for more patients. So talking about some pretty new data and a very newly minted FDA approval, like weeks, Dato-DXd in this space. So do you want to walk us through the TROPION-Breast02 study and what that told us and why we got this approval?
Sure. So TROPION-Breast02 was a phase 3 randomized trial that randomized patients who, and I appreciated this about the design, it didn't matter how long their disease-free interval was, which means that in those patients that even if they had progressed within the first 6 months, they were eligible for this study, which I appreciated. But those patients were randomized, and there was some proportion that had PD-L1 positivity, but that was capped and represents a smaller proportion. But essentially what we see most commonly, and that's in the metastatic triple negative setting in the first line, randomizing them to either receive the Datopotamab Deruxtecan or single agent cytotoxic therapy, physicians of choice.
And sometimes when we think about these trial designs, you wonder, are we just pointing out factors that are different to then defend our decisions down the road? But this is biologically relevant, I would say, right? This short disease-free interval matters. Like it's a real issue. Patients are recurring quickly, and when they do, these are the worst of the worst, right? Absolutely. So, and in this trial, we found that Dato-DXd was our significantly positive drug, right? Do you want to talk about the endpoints a little bit?
Sure. So endpoints for this study was a dual primary endpoint of both progression-free survival and overall survival. And both of these were found to be statistically significant. So almost a doubling of PFS and then a 5-month improvement in overall survival.
And I want to come to that point about dual primary endpoints. So again, is it something we just academically talk about, or does it actually matter? Praveen, do you want to comment?
It's very important, especially when you want to challenge the standard of care. So, we thankfully had some options in triple negative breast cancer space, especially, with some of the novel ways of thinking about these, and especially for PD-L1 positive patients. We didn't have as many options for PD-L1 negative, or we can call immune checkpoint inhibitor ineligible, but at least we had some cytotoxic drugs combinations, ADCs later. But it's very important that when we bring something in first line space and challenge the standard of care, that we show long-term outcome benefit, and that's where overall survival does matter. So I think a drug that improves OS in the first line setting is something that we would really want to look at, and I think we feel good with the data from Dato-DXd. That it showed a significant, not just PFS, but OS benefit.
Right. It sort of gives you the maximal reassurance for your patients that if you choose this as an option, to the best of our knowledge, that they should benefit. Now we know it's not everybody, right? And that's the most frustrating part of our world. But if you go in with your best intentions, having a drug that shows overall survival is really helpful.